test the Babinski sign, your doctor will use an object such as a reflex hammer or a key to stroke the bottom of your foot from your heel up to your big toe. Your doctor may scrape the object roughly across the bottom of your foot, so you might feel some minor discomfort or a tickle. It takes practice to properly perform the Babinski test. Rodent reflex. This reflex starts when the corner of the baby's mouth is stroked or touched. The baby will turn his or her head and open his or her mouth to follow and running in the direction of the stroking. This helps the baby find the breast or bottle to start feeding. This reflex lasts about 4 months. Glabellar reflex is a reflex test by a repetitive tapping on the forehead. Subjects blink in the response of the first several taps. If the blinking persists, this is known as Mearson's sign and is abnormal, and a sign of a frontal release.
To examine the jaw jerk reflex, you have to place your index finger over the middle of the patient's chin with the mouth slightly open and the jaw relaxed. Once you do that, you have to strike your finger with the reflex hammer. The jaw should not deviate to either side. The jaw jerk is usually absent or weakly present.
The Achilles reflex test is also called the ankle reflex test. It's a deep tendon reflex that can be easily tested with the use of a standard reflex neurological hammer. The Achilles reflex test is a simple and effective part of a complete lower extremity examination. It is also part of the nervous system portion of a complete history and physical examination. There are a lot of ways to conduct the Achilles reflex test, but the basic method is what examiners use the most. The Achilles reflex test is to primarily assess the S1 nerve root, which innervates the area.
In the biceps reflex, the forearm should be supported, either resting on the patient's thighs or resting on the forearm of the examiner. The arm is midway between flexion and extension. Place your thumb firmly over the biceps tendon with your fingers curling around the elbow and tap briskly. The forearm will flex at the elbow. This reflex is produced by the spinal nerves of the C5 and C6. For the brachioradialis reflex, the patient's arm should be supported. Identify the brachioradialis tendon at the wrist. It inserts at the base of the styloid process of the radius, usually about 1 cm lateral of the radial artery. If in doubt, ask the patient to hold their arm as if in a sling. Flex it at the elbow and halfway between pronation and supination, and then flex the forearm at the elbow against resistance from you. The brachioradialis and its tendon will then stand out. Then, to check the reflex, place the thumb on the hand supporting in the patient's elbow on the biceps tendon while tapping on the brachioradialis tendon with the other hand. Observe 3 potential reflexes as you tap. One is the brachioradialis reflex, that is a flexion and supination of the forearm. You can see 2 the biceps reflex, that is a flexion of the forearm, and the finger jerk, that is a flexion of the fingers. The usual pattern is only for the brachioradialis reflex to be stimulated, but in the presence of hyperactive biceps or finger jerk reflex, this reflex may be stimulated also. This is a C6 and C5 reflex too.
To do the patellar reflex, at first you have to identify the patellar tendon. Once you do it, strike the tendon directly with your reflex hammer. You have to make sure that the quadriceps are exposed so you can see the muscle contraction.
The tricep reflex, it is initiated by the cervical spinal nerve. The reflex is tested as part of the neurological examination to assess the sensory and motor pathways within the C7 and C8 spinal nerves. The test can be performed by tapping the tricep tendon with the sharp end of a reflex hammer while the forearm is hanging loose at the right angle to the arm. A sudden contraction of the tricep muscle causes extension and indicates a normal reflex.
For checking the Hoffman reflex, the patient can be standing up or sitting down. Then he or she will support his hands or her hands on yours so the patient can relax every muscle. Then the patient will bend his fingers and you need to take her middle finger with your hand in the distal interphalangeal joint. After that, you will flip the middle finger with your thumb, and if the Hoffman reflex has a positive test, the thumb and the index finger of the patient will join. This can be caused for a C6 and a C7 nerves failure. To check the palmamental reflex, you need to put the hand of the patient over yours so he or she can relax his hands and we can continue with the procedure. After that, you will make a scratch with one of your fingernails into the part of the hand that is below the thumb. After making the scratch, the patient's mouth will make a little smile-like movement. That will prove that the test is positive. This reflex can be caused by a failure on the C5 and C7 nerves. Checking the upper hem reflex can be a little bit easier because you only need to check the toe extension by hitting the middle tibia. If there's a movement, then there's a failure. This reflex is caused because of a failure in the S1 nerve.